So, tonight's topic is two initial struggles of new HO and how to overcome them. Okay, so basically these are two major challenges faced by a lot of new housemen, not necessarily just takers, because these two challenges these two struggle actually persist for a few weeks or months, depending on how fast you adapt to the working system. Okay, so we'll see what are these two initial struggles, and along the way, we will discuss how to overcome them. Okay, so I hope you are ready with your notebooks. Okay, this is my notebook. So be ready with your notebook because along the way there will be a lot of action plan then that I hope you can jot down. Okay, as preparation for your housemanship soon. Okay, and along the way, I will try to make this session more interactive. Okay, I will ask a lot of questions. I hope you feel free and don't be shy to answer in the comment. Okay, so perhaps the most active ones who are answering in the comment can get the free seat to clinical skills workshop. Okay, so be ready with your notebook. And I'm sorry I didn't manage to share the slides on my Telegram channel. I will share the slides shortly after we end our session on my Telegram channel so that you can refer back to the slides. Okay. Okay. Okay, so inshallah, let's start. This our presentation outline for tonight. I will spend about 1 hour as well because I think it'll be more beneficial if I give a lot of example, okay, and also a case discussion so that you understand you understand the topic more in depth, and also you see how we should apply the knowledge in your daily work as houseman. Okay, so let's have a little bit of practice. Okay, so basically tonight we will cover two initial struggle for new housemen and how to overcome them. Okay, the first struggle is how to adapt to the working system. Okay, so we will discuss about this further. Okay, what is the system? Okay, and to make you understand further, okay, we'll see how does a day in a HO life looks like. Okay, what you will be doing from the very beginning in the morning, okay, sampailah petang malam. Okay, so apa you punya routine as a houseman. Okay, next is the second struggle and the most neglected ones is how to understand the clinical significance of what you do every day as houseman. Okay, so usually when a new houseman start even as first poster or subsequent posting during their initial period of adaptation in the new department, they will focus on the first struggle or the first challenge. That is how to adapt to the working systems, how to work, how to be functional as a houseman. Okay, after a few weeks or a few months, they get to macam dah tahu lah nak buat kerja macam mana. Okay, so they usually don't have much problem on how to do or execute the work. Okay, they know how to clerk, they know how to review, they know how to do referral, but usually they don't realize that they don't really understand the clinical significance of what they do. Okay, so this is a issue that I have been observed for the past few years, for the past 9 years in training houseman. Okay, so to understand the second challenges, okay, we will have a short case discussion in the second part of our discussion tonight. Okay, so please, along the way, I will ask a lot of questions and we will discuss what we can do together to overcome these two struggle, or to make sure your adaptation to the working life as houseman more tolerable, and how to ensure that you can adapt much faster towards the working life. Okay, and please stay to the end of the session, okay, because I will have announcement on new departmental courses, and also the three lucky doctor who actively ask question, answer my questions, and also stay towards the end of the session will be selected to three complimentary seats to clinical skills workshop this Sunday. Okay. Okay. And if you have questions along the way, please just ask in the comment section lah. Okay, so let's start. Bismillahirrahmanirrahim. Okay, so the first challenge is adapting to the system. Okay, adapting to the working system. So what is the working system? Okay, so the working system is what you are supposed to do. Okay, so regardless of where we graduated, okay, I usually not all housemen have a clear idea of what they should be doing on the first day of your tagging, or on your first night shift, on your first OT call, or your first clinic day. Okay, so we don't really know what we are supposed to do. Okay, and even if we know what to do, okay, kita tahulah. Means kalau tak tahu nak buat apa ni, boleh tanya senior kan. Okay, what I can help. Okay, so mungkin senior bercakap, okay lah, you boleh clerk case. Okay, you boleh ambil darah. You boleh tolong review patient yang baru masuk atau patient baru balik daripada OT ni kan. You boleh tolong buat referral. Okay, you might know what you need to do by asking, but how to execute the thing that you're supposed to do is another challenge. Okay, and these are not directly taught during our medical student years, okay, and especially if you're graduated from overseas and you don't have any experience seeing how we work in a Malaysian setting, in Malaysian hospital, okay, this might be a huge challenge for you. Okay, for those who graduated in local university, so usually they are quite familiar with the routine. Okay, means bila you all dekat clinical years, okay, some university dah ada HO shadowing program after you graduate. Okay, so you might have a rough idea on what HO need to do on day-to-day basis, but usually despite this clinical experience, or despite this shadowing, not all housemen, not all medical graduates know how to execute what they are supposed to do. Okay, clerking usually is not a problem. Okay, but how to do review, how to do procedure, and how to communicate your finding. Okay, means how to present, how to request scan, and how to do referral are usually quite challenging for new housemen. Okay, so let's see a day in HO life. Okay, so saya nak tanya, please answer in comment. Okay, I will wait for a few comment to appear before I proceed. Okay, if you're working in a usual AM shift, okay, shift kita datang pukul 7, start pukul 7 pagi kan. Okay, what usually the first thing a HO need to do in the morning? Okay, please answer in the comment. I want to see, do you have an idea of what HO is supposed to do? Okay, so what do we need to do the first thing in the morning when you come for your AM shift? Okay, so Darren said taking blood. Divya Darshini said take blood. Okay. Okay, review patient. Fazrin answer review patient. Farah Rashikah answer new review patient. Clark new case. Review blood result taken. Okay, okay. Blood taking, review, document everything, Muhammad. Okay. A Clark new patient. Okay, let's see. Okay, usually okay, I'm sharing this a day in his life based on a medical ward lah. Okay, the routine in what we experience in our medical ward. Okay, so usually, yes, you are right. We start our day with morning blood. Okay, so some of our patients in the ward need a daily blood. Means we need to repeat the blood taking every day. Some patient need BD or twice daily. Some patient needs TDS or thrice daily. Okay, for example, dengue patient. Okay, so we need to take their blood at usually 6 a.m. in the morning. Okay, but for some department, because a houseman work in shift, sometimes the morning blood will be taken by the night shift people. Okay, so those who work during the night shift before they end their shift, okay, at 7 o'clock in the morning, so they will take the morning blood. Okay, so if the morning blood is the job of night shift people, okay, so the morning shift people can straight away come and start their morning round or morning review. Okay, so you need to know when you start taking later, you need to know whether this coming morning blood or morning blood taking ni is a task of the AM shift houseman, or is it a task of night shift houseman. Okay, so usually kalau medical ward sebab yang kena ambil morning blood tu ramai sangat, is usually half of the ward or more, so usually the AM houseman need to take the morning blood. Okay, but in other department, in pediatric, surgical or NG, where the coming morning blood is not that much, so satu ward mungkin 3-4 patient je, usually the night shift people will be in charge of the blood taking. Okay, Dr. Yazid bagi tahu biasa pukul 5 am ambil darah. Okay, yes, the timing that I mentioned here is just a rough estimate. So okay, you need to adjust according to how many patients you need to take blood, you need to cover during your morning walk rounds, your pace of taking blood and doing rounds. Okay, so kalau you dah senior, mungkin you tak ambil masa banyak sangat untuk ambil darah and buat rounds. But when you are new, ambil darah tu satu patient mungkin ambil masa, nak review satu patient mungkin ambil masa, so you might need to come much earlier. Okay, and it also depends on pukul berapa MO you datang untuk buat round. Okay, so if your MO come early, so you need to come much earlier to finish your round before your MO come lah. Okay, so first we do our morning review or morning rounds. Okay, so this is when you ask your patient, okay, macam mana semalam. Okay, this is when you examine your patient, existing patient in the ward for new finding. This is when you trace the latest investigation result and document in the BHT or patient file. Okay, so morning rounds, it depends. Usually for medical ward, you need to cover 8 to 12 per houseman. Okay, for other wards, pediatric, surgical base, usually you need to cover 4 to 8. Okay, so that is the average number lah. Okay, then after you do your own morning round, so you assess patient, you update patient on your own. Okay, and you do the documentation. Then usually around 7:30 or 8 am your MO will come. So you will need to present those cases that you have updated to your MOs. Okay, and then when your specialist come, you need to present again the case to the specialist or consultant. Okay, most of the time, if you manage to do your round or you manage your present all the cases that you have updated to your MO will present the case to your specialist or consultant. Okay, sometimes your MO and your specialist come together at the same time. Okay, so you need to present all the cases to your team lah, MO, specialist and consultant straight away. Okay, so your round will finish usually at 10. It actually depends on how many patients you have and the style of your MO and your specialist. Okay, Some specialists like to do teaching round, okay, and it also depends on the condition of your patients, okay. Condition of your patient means if you have a lots of unstable patient, complicated patient, your round will be more prolonged, okay. If most of the cases are simple, straightforward case, we will finish much earlier, okay. So when your AM round finish, what you need to do is you need to carry out the active plan. Okay, so these are usually orders given by your team, your MO, your specialist during AM round. Okay, so there will be a lot of blood investigation to take. There will be forms to fulfill. Okay, when when you need to take blood, you need to fill up form. Okay, and you will need to fill up form for referral, scan request. Okay, for procedures you need to fill in the consent, and then you need to execute all these tasks lah. Lepas isi form, ambil darah. Lepas isi form, pergi call the MO to do referral. Okay, go down to radio to request for scan. Okay, call up the NS team to book for op. Okay, and also execute the procedure after you have the consent and you have everything. Means the things you need for that procedures lah. Okay, so berapa lama masa yang kita ambil untuk carry out plan ni bergantung kepada your pace of work, how many patient you have, and also the most important predictor is your teamwork. Okay, so usually if we have a good teamwork, we can divide the task. Okay, means one houseman can in charge of all the blood takings and form, one houseman can in charge for specific tasks, so that your active plan can be done much faster. Okay, but bear in mind, okay, along the way, okay, while settling your active plan from the morning round, you will have new cases arriving to your ward, so you need to clock them. You will have transfer in cases, okay. For example, a patient yang baru discharged from ICU be transferred into the normal ward, so you need to review those cases as well so that you know the case, okay. If you're in a surgical based department, you will have patient coming back from OT, so you need to review their condition after coming back from OT, okay. And you will have other patients in the ward with active complaint. Okay, doktor, Branula saya sakit lah, doktor saya rasa susah nafas lah, doktor saya rasa pening lah. Okay, so these are existing patients with active complaint. So houseman need to attend, assess them. So basically you're doing a short review on them lah. Okay, ask what are the chief complaint is. Okay, do a relevant physical examination, do relevant bedside investigation. Okay, and think what is the patient currently having lah. Okay, and along the way we have your staff nurses. Doctor, Branula required. Branula required means these are the patients who needs Branula. Either they have a new IV drip or IV medication, intravenous medication to be served to them, or their existing Branula has bung or not working. Okay, so you need to insert it back lah. Okay, and then you will have unstable patient collapsing. Okay, BP drop lah, ada upper GI bleed lah, lower GI bleed. So you need to resuscitate in teams all these unstable patient. Okay, before you need to start your AM round, your PM round at 2 PM. Okay, so sempat lunch ke tak? Kalau sempat habis kerja, sempatlah kita lunch dan solat Zohor. Okay, usually if you have a good teamwork, we will manage to finish everything and have a short lunch break and solat lah. Okay, so most department will require you to do PM round. Okay, means basically at 2 PM you will need to repeat the process that you do in the morning, but usually PM round are more fast because we kind of macam dah tahu dah case tu pagi tadi apa. So kita just nak tahu order yang pagi tadi dah execute ke belum. So kalau dah hantar darah, result dia dah balik ke belum. Kalau dah request scan, radio team dah panggil ke belum. Okay, kalau book OT, bila dia orang nak panggil. Okay, so PM round are usually more short, okay, short and concise. And then usually after PM round we will have teaching or continuous medical educations. Some teaching are just for houseman. Okay, houseman je kena pergi. Ada teaching yang everyone kena pergi, MO kena pergi sekali. Okay, so you need to know lah. Usually semua teaching houseman kena datang. Okay, and then okay, so 4:30 when your next shift people come, you need to pass over to the HO in the next shift. Okay, so passover ni apa? Passover ni adalah kita update. Okay, be careful, you cannot pass over leftover jobs. Okay, certain things that you need to be done during your shift. Okay, maksudnya patient datang sebelum pukul 5. You clerk case sebelum pukul 5. Okay, so kena habis clerk, kena buat semua active plan dia sebelum pukul 5. Apa yang you boleh pass over to the next shift is contohnya you dah ambil darah, you rasa patient tu punya result mungkin tak okay. Contoh patient tu nampak pale, okay, so you ambil FPC, cakap okay please trace the FPC, ataupun you nampak patient tu very dehydrated, so you dah hantar dia punya renal profile and electrolytes, then you can pass over to the next shift, kata I dah hantar RP stat, can you please trace and review urgently sebab takut electrolytes tak okay. Okay, so usually we pass over unstable patients. Okay, what the next shift houseman need to review or be careful. Okay, contoh patient yang kita baru CPR ke, patient yang baru intubate ke, you kena review the chest x-ray post intubation, chest x-ray post pleural tapping, nak tengok ada certain complication macam pneumothorax ke. Okay, so those are the things that you can pass over. You cannot pass over the job that yang kita tak sempat buat. Okay, tak sempat buat sebab patient ramai ke, tak sempat buat sebab kita lambat buat kerja. You still need to finish that job, okay, before you come back. Walaupun dah ada orang next shift yang datang. Okay, sebab next shift akan buat kerja yang next shift punya kerja lah. Okay, so you cannot simply pass over. Okay, so Fazrin cakap takutnya tak boleh manage. It's okay if you have a good teamwork, we can manage insyaAllah. Okay, kalau banyak kerja, ramai-ramai buat sampai siap baru semua orang balik. Okay, okay, so pukul berapa kita balik ni? Pukul berapa boleh balik? Okay, so kalau you dah off tag, pukul 5 boleh balik lah kalau kerja semua dah siap. Tapi kalau kita tagging, pukul 5 kita kena pergi tagging dekat active ward atau OT lah. Okay, so active ward ni bermaksud ward yang sedang menerima kemasukan pesakit. Okay, okay, so during tagging 5 PM to 10 PM you do what you are supposed to do as any houseman yang kerja PM shift lah. Okay, you clerk new case, sama juga you transfer in new cases. Okay, so you attend patient with active complaints, granular required. Okay, resuscitate unstable patient, and 8 PM if you are required to do TDS or on-call review, then you can start your on-call or night review at 8 PM. Okay, so certain department only require you to do on-call review for unstable cases. Ada wards yang you need to do on-call review for all patient in your wards. Okay, and usually around 9 the on-call specialist will come to the round. Okay, so the same process repeat. You need to present the cases to your on-call specialist, and hopefully at 10 PM you can go back on time. Okay, if there's no pending cases, no pending job to be done. Okay, and usually if you are tagging, before you go back, you need to update or you need to meet the MO on call that night Okay. Usually mungkin kena ambil signature dia. Okay, some MO are very strict with taggers, means they want to see you before you go back. Usually they will be macam dia akan tanyalah berapa kes yang you dah clerk hari ni, so practice presenting case. Okay. Okay, so okay, ada few questions. Farahana asked, Doctor, is it a big deal if orang lain order investigation tapi orang lain buat that procedure? Okay. If orang lain order, okay, biasanya yang order tu MO atau specialist, yang kena execute tu memang houseman. Okay, so by right, houseman yang kena buat prosedur tu adalah houseman yang in charge that patient lah. So maksudnya kalau contoh MO order kena buat pleural tapping untuk patient dalam cubicle you, by right you are responsible to ask for consent and arrange for the procedure to be done. Okay, kalau MO benarkan you buat on your own, you boleh buat on your own. Biasanya this kind of more invasive procedure MO akan buat bersama you. Okay, some ada kalau you dah pernah buat, dia orang akan benarkan you buat with direct supervision. Okay, kalau you tak pernah buat, mereka akan tunjuk so that you can observe the procedure. So no issue if someone else order and orang lain yang buat. Yang penting ada orang buat sahaja. Okay, so if you are quite senior, you boleh tolong your taggers to execute procedure or job list for their patient. Maksudnya kalau you dah settle patient yang dalam cubicle you boleh tolong cubicle lain punya ni lah. Okay. Okay, Hazirah Takini Hafizan tanya, what is the difference between 6 am and 10 am blood taking? Okay, so you are right, the 6 am blood taking is the routine one. Okay, so patient yang existing dalam ward tu, kalau dia kena ambil daily blood, so kita akan ambil pukul 6. So kita dah tahulah patient ni memang hari-hari kena ambil darah dia. Okay, ada patient yang seminggu 2 kali. Kalau di hospital saya, chronic or long staying patient, hari Isnin dan hari Rabu kena ambil darah dia orang. So kita tahu Isnin dengan Rabu akan banyak coming morning blood. Okay. And the 10 am blood taking is blood taking yang baru MO or specialist order. Mungkin darah yang pukul 6 tadi atau darah yang sebelum ni tak normal, so kita nak repeat. Okay. Or we suspect a new problem arise, so kita nak ambil darah baru, so we will take at 10 am. Okay. Okay, so Iziani cakap pukul 10 PM kita nak balik tu lah, baby grunting, patient SOB, patient collapse tu biasa. Okay. So Devia Darshini tanya, HO ada punch card juga? Yes, HO ada punch card. You kena punch card, cuma certain hospital dia pakai thumbprint ataupun you flash your ID card, your name tag is your ID card. Bila you masuk, you just macam tat macam tu je lah. Okay, but you need to punch in and punch out. Okay. Okay, Renuka Krishnan asked, Dr. Can you explain about tagging? Renuka, we have covered about tagging quite depth in our previous session. Okay, you can see in my timeline or in Medicop YouTube. Okay. Okay, Hani Ganizan asks, incision of branula for IV drip to HO buat ke? Yes, HO buat. Sometimes your nurses can do. Okay. Contohnya kalau pediatric lah. Okay, biasanya the nurses are more experienced. Okay, but you kena ingat sebagai seorang doktor, apa-apa yang nurse tahu buat, doktor mesti kena tahu buat. Okay, so it doesn't really bila you baru, tak perlu kisah sangat ni kerja siapa. Okay, yang penting you belajar untuk buat lah. Okay, so any houseman should know how to insert branula. This is one of your compulsory procedures. Okay, and biasanya requirement to off-tag as well. Kena pandai buat branula baru boleh start on call lah. Okay. Okay, Darren Lim. Is HO task routine also involve interpreting ultrasound? Okay. If you are in ONG department, yes, you need to be able to do a bedside ultrasound, okay, for a patient with early pregnancy. Okay, so you need to be able to diagnose a miscarriage, complete miscarriage, ectopic pregnancy. You need to do a parameter scan for second trimester and third trimester patient. Okay, so if ONG, you need to know how to do the scans and how to interpret the finding as well. But for other department, for medicine, surgery, usually ultrasound will be done by the radiologist or radiology MO at the radiology department. So what you need is you can wait for the report to be available in the computer system or the printed report to be available lah. Okay, but as for other imaging, okay, for CT scan, the one that HO needs to know are the important ones, like how to differentiate ischemic stroke and intracranial bleed. Okay, yang tu you need to be able to interpret yourself. But either, for example, tumor, okay, a more complicated scans, we can rely on the reports. Okay. Okay, a lot of questions. Kejap I think I have quite a number of senior housemen yang tolong jawabkan soalan you all. Dr. Aisyah Mahiran, thank you. Okay. Okay, I will answer ada yang soalan-soalan yang tak dijawab lagi lah. Okay, so Amir Zakwan Hamdan tanya, kalau hospital, if the hospital is using computerized system to order investigation, do we learn to use the system during the tagging period or prior to that? Okay, if you're working in computerized hospital, usually during your orientation period, hospital orientation, they will teach you how to do how to use the computer system lah. So macam mana nak key in you punya notes, macam mana nak order investigation, macam mana nak trace investigation. Okay, diorang akan ajar waktu hospital orientation, but usually you will need some practice baru you biasa lah. Okay. Okay, Emily Tang asks, can we take blood from existing granula if difficult to find vein? Okay, you can only do this if the patient have a granula for blood taking. Okay, so usually we practice this in pediatric department. Okay, those patients which require frequent blood taking, for example, dengue patient, they will have separate granula, one granula for IV drip and medication, one granula for blood taking. If the patient have granula for blood taking, you can take blood from the existing granula, but you cannot take blood from the granula that we used to give IV drip or medication, because the result will be inaccurate. Okay. Okay, Afiq Shah. Afiq Shah tanya, what happen if for some reason HO punya interpretation or diagnosis differ with MO? Okay, so this is a good question. Sebab this is the reason why bila buat review tu, houseman kena present dekat MO. Bila kita clerk new case, kita kena present case tu dekat MO, supaya memang tugas MO untuk check sama ada kita punya clerking tu complete, kita punya physical examination tu complete and finding kita correct, whether our diagnosis is correct. Okay, so it's okay. This is HO ni you punya latihan kan, latihan siswa-siswa, it's your training period. So it's okay to differ. Kalau diagnosis you tak accurate ataupun for some reason, you boleh justify kan, you boleh bagi tahu you kenapa you rasa patient ni ada diagnosis macam ni, and MO akan double check lah. Okay, it's not an issue. Okay, because you're still in training. Even among MO and among specialist pun kadang-kadang dia orang punya interpretation of diagnosis berbeza. Okay. Okay, kejap Okay. Kirosha Kolanda asks, Doctor, usually once blood is sent to the lab, how long can the result be obtained? Okay. Every investigation have their own lab turnover time. Okay, so lab turnover time is how long the result time they need to process. Okay, for example, ABG is instant. Maksudnya you masuk je kat machine tu, within few seconds you dah dapat. Sama macam full blood count, it will take macam less than 1 minute for you to get the result. Okay, but for example, renal profile, liver function test, coagulation profile, it usually take 1 hours. Okay, so the lab turnover time is 1 hour, means if you need that urgently, you need to run to your lab, okay, and mention that this is an urgent blood investigation. For example, you have a TSB, total serum bilirubin, with patient with very high TSB, so you takut kena exchange transfusion. So this TSB is urgent. So you take the blood, you bring to the lab and bagi tahu this is urgent blood. Okay, I will trace in 1 hour. So you along the way you need to know what is the lab turnover time, especially if the result is urgent, if the investigation is urgent lah. Okay. For example, non-urgent ones like thyroid function test, or cord blood. Okay, cord TSH will take 3 working days. So different investigation have different lab turnover time. So you need to know this lab turnover time, so that bila the turnover time has arrived, your MO expect you to know the result. Okay, so for example, M round tu MO suruh repeat FBC dengan FBC dengan renal profile kan. By PM round mesti dah ada result tu, sebab the turnover time is only 1 hour. Okay, tapi kalau you ambil hari ni cord TSH ataupun thyroid function test, okay, semua orang tahu after 3 days baru result tu datang. So kalau ambil hari Isnin, you have to trace on Wednesday lah. Sama juga dengan blood culture. Okay, so different investigation have different turnover time. Okay. Okay. Divya Darshini asks, ultrasound interpretation in ONG will be teach time HO. Yes, along the way tu, bila ONG, bila you clerk case, you need to do scan kan, if indicated. So that's when you learn lah. Okay, you will learn along the way during the posting. Okay, so last question so far before we proceed. Okay, Afisha asks, do HO need to perform intubation? Okay. Intubation is one of your compulsory observe procedure. Okay, so sebenarnya kalau you observe sahaja pun dah cukup, but some department, district dia nak houseman ada, for medicine and surgery, intubation is your compulsory observe procedure. So you observe saja pun tak apa. Cuma ada department yang district dia nak houseman dia pernah intubate. Okay. Kalau NS, if you are houseman in anesthesia, intubation is compulsory perform procedure. So you mesti buat lah beberapa kali sebelum you boleh pass the department. Okay. Okay, good everyone. Semua banyak tanya soalan. Okay, so let's continue. Okay, so this is our first struggle, how to adapt to the system, the working system lah. Means your first and foremost challenges when you start working is to know what you're supposed to do, okay, and to know how to execute that particular task lah. Okay, so let's brainstorm. So apa yang kita boleh buat sekarang sementara menunggu ni untuk memastikan kita punya first challenges ni akan lebih mudah diatasi. Okay, what do you guys think? I need a few answers before I proceed with my suggestion. Okay, so kalau you dah tahu kan, this is what HO supposed to do. Okay, this is what a day in HO life will be. So knowing all this, what you can do while waiting to make sure nanti bila you tagging tu dia macam tak struggle sangat lah. Okay, I want to see a few suggestion in the comment. While waiting for your suggestion, I will ask another Apa ni? A question. Okay. Sivashni asks, during emergency HO can do CPR or only MO and house MO nurses. Okay. Okay. So, kalau nurse kena buat CPR, houseman mesti kena buat CPR juga because your rank is higher. Okay. Any medical, any healthcare staff should be able to do, must know how to do a good CPR and resuscitation. Okay, so let's see what's your suggestion. Study betul. Learn the basic of DOPS procedure. Yes, at least you get an idea how to execute the procedure. Okay, good. Read CPG Sarawak Handbook. Yes, be familiarized with the common management. Good. Okay, use Rizal bagi tahu practice. Nordiana Muhammad no. Revise theory. Fazrin study common cases. Good. Memorize all the normal value. Okay. Sekarang ni tak payahlah hafal lagi sebab you tak jumpa hari-hari, so you mungkin akan lupa. Okay. Tapi kalau you baca case note, you boleh relate lah. Contoh you baca dengue, then you akan automatically ingat apa normal value kan. Okay. Okay, Divya dari sini tanya, boleh kita schedule dekat hospital yang kita nak buat houseman? I think previously boleh buat elective while waiting for your posting, but due to the COVID, I think they don't allow it anymore. Okay, what you can do is you can do pre-tag. Maksudnya bila you dah masuk dekat hospital tu nanti, before your actual tagging, you can do pre-tag. Okay, Darren Lee bagi tahu practice physical examination. Yes, betul. You have to practice the steps sebab cuti lama kan, setahun. You might forget all the steps. And your physical examination is part of your assessment juga. Your mini clinical evaluation is usually the specialist will assess how you do physical examination. Okay, Emily Tong, join courses. There's a lot of online free CME as well. Okay. Okay, bagus. Okay, I want to highlight this. Gen Medical course. Thank you. Okay, Okay, Bong Pengda, need suggestion on which book to read? Procedure like conducting delivery, cesarean section, FNAC through cut biopsy. I think biopsy is quite advanced for you. It's compulsory observe. No need to worry too much. But conducting delivery is your compulsory perform. So I'll share the link to video how to conduct delivery. Perform during one of our ONG courses. Okay. Use Riza Roslan, get fit. Yes, sebab kalau you start kerja tu daripada pagi sampai malam tu berlari-lari ke sana sini. Okay. Yeah, Tafiz Ahmad, start thinking like a doctor. Betul. Maksudnya bila you study common case tu, you tak boleh study macam dulu you medical student. Kalau medical student kita study daripada apa? Kita study daripada epidemiology, pet fees. So it doesn't work like that anymore. You need to study macam contoh dengue. Okay, kalau patient datang kita nak tanya apa? Kita nak tanya soalan apa? Kita kena examine apa yang kita nak cari on physical examination, apa investigation kita nak order, apa yang kita expect daripada investigation tu. Okay, saya nak buat plan of management apa. So you need to start thinking like what you will be doing as a houseman. Nak tanya soalan apa, nak examine apa, nak investigate apa, nak buat plan apa. So you need to macam turn the way of how you study. Okay. Okay, too familiar the system in computer hospital can start tagging before real tagging. Okay, pre-tag should be enough. Okay. Practice waking up early. Okay, yes. Okay. Bong Pengda is okay. Nanti clinical skills workshop kita akan belajar step by step how to deliver babies. Don't worry, okay? So, okay, you guys have answered everything I think that I have included. So, okay, this is my suggestion on top of what your friend suggest just now. What you can do is you can ask your seniors, okay, your university seniors, okay, yang dah start kerja kan, okay, what was their initial struggle and how they adapt, okay, what are their tips, okay. Okay, and try living the new routine. So, you tahu houseman ni kena bangun awal. Okay, so kena lari sana sini, makan sikit. So, you need to build a physical fitness. Pergilah jogging ke, sekarang tak boleh pergi gym ke, dah buka gym. Okay, naik your, bicycle, your treadmill, okay. You can do your intermittent fasting for Muslim, boleh puasa Isnin dengan Khamis, okay. Sebab lepas cuti setahun, makan mungkin berapa? 5-6 kali sehari, okay. PRN basis kan. So you need to try to practice living as houseman. Okay, bangun pagi, get fit, eat less. Okay, and learn how to execute all the tasks. Okay, so this one ada yang dah diajar di medical school, ada yang tak. Okay, you can learn during our courses and pre-tag if possible bila you dah start houseman nantilah before your actual tagging. Okay, so I will, okay, this is by one of our alumni at Nota Perubatan punya Telegram channel. Please follow this channel if you haven't follow it. Okay, so it's quite sad lah. Walaupun ramai houseman sekarang, sometimes there's still cases di mana houseman kena jaga ward seorang-seorang atau 2 orang, okay. So, please prepare yourself properly sebab kadang-kadang kita bukan tak nak ajar tapi tak sempat, okay. If you know the basic stuff, okay, it will be much easier for you and for others as well, okay. Okay, so short promotion. Okay, so some were asking what are the difference between pre-HO essential and advanced. So basically essential is for you to understand what is housemanship in Malaysia about, kenapa you kena buat housemanship, lepas houseman macam mana, nak masuk permanent service, nak pilih hospital. And then road to HOship, some of the I have covered during our free CME, weekly CME, assessment, diseases and drug that you need to know, okay. And also about tagging, tagging in OT, tagging in ward, okay, your assessment, and also how to manage your ward work. The general things will be covered in pre-HO essential, while in pre-HO advanced, we will cover specifically how to execute all these specific tasks. Okay, for example, macam mana nak clerk case. Lepas clerk case, you kena isi form, you kena formulate plan, you kena endorse medication. Okay, we will learn in advanced pre-HO and there will be some practice as well. Okay, and then how to do review. Okay, this is your bread and butter in housemanship, doing review or updating patient. Kalau you tengok dekat kita punya a day in HO life tadi, pagi you buat round and you have to cover few patient, PM you have to do rounds lagi, you have to cover a few patient again, and night shift you have to cover more patient because tak ramai houseman kerja night shift, okay. And what more we cover in advanced pre-HO, we cover how to present, okay. Surprisingly, what we expect from houseman, how to present case is nothing like we were taught in medical schools, okay. So beramai houseman yang struggle about presenting, and how to do referral, requesting all your communication skill. We will cover that in advanced pre-HO, okay. And we have our Chinese New Year sale until this Thursday, okay. Okay, so let's proceed with our second struggle. Okay. Okay, second struggle Okay. So our second challenge is to understand why you do the thing you need to do before. Okay. So a lot of housemen think they are good enough or they are excellent enough when they know how to do the the ward work. Okay, bila dia dah boleh present case, dah boleh refer, dia punya request semua granted. Okay, buat prosedur semua dah pandai, usually houseman akan jadi a little bit complacent. Okay, and not many housemen realize that despite knowing what to do, they also need to understand why they need to do that. Okay, so kenapa penting untuk faham apa yang kita buat ni? Okay, this is ramai yang husband tak perasan lah. Okay, bila dia orang dah tahu buat kerja macam mana, dia orang terlupa yang dia orang kena faham kenapa dia orang buat macam tu. Okay, kenapa you kena faham? Why you need to understand the why is because all this why, kenapa you ambil darah untuk patient ni 3 kali, kenapa you kena ambil darah ni untuk patient ni, kenapa you bagi management ni, all this why is your favorite assessment question, be it during your off-tech assessment, your mini clinical evaluation or case-based discussion. Okay, so bila kita baru, waktu kita tagging tu kadang-kadang kita buat macam kita hafal je benda. Okay, macam mana nak ambil darah? Okay, kalau case tinggi, apa management dia? Kalau case asma, macam mana management? Most of the time kita hafal dia punya template of management tu sebab kita tak sempat nak fikir. Okay, kalau advance macam Tafiz ni, dia bagi tahu management plan boleh guna Venom's formula. Okay, good. If you can think, good. Okay, but most of the things macam investigation list, we actually hafal lah the template of management. Okay, but bila you punya assessment ni, yang akan ditanya adalah kenapa you buat certain things, kenapa you manage macam ni, apa semualah. Okay, so it will be good if right from the start, ataupun kalau tak sempat waktu tagging tu, bila you dah quite okay with doing the ward works, okay, it's a time for you to start studying or asking around why you do the thing you did. Okay, and also this is in the long run, understanding why you need to do things is very important to prevent stress and burnout from the routine. Okay, sebab waktu kalau kita mula-mula jadi houseman ni, our struggle was to nak tahu buat apa kan, nak tahu kita buat apa, nak buat macam mana. Okay, tapi lama-lama bila dah tahu nak buat apa tu, ramai houseman jadi macam dah tak ada challenges tau. Okay, dah semua benda dia dah tahu buat. So everything becomes a routine. So diorang kita akan jadi either burn out, ataupun kita jadi stress, ataupun kita dah tak ada motivation to learn. Okay, so you need to ensure that you continuously learning. Okay, bila you dah tahu nak buat apa, nak buat macam mana, please make sure you understand as well why you need to do those things. Okay, sebab only by understanding the significance of what you do, you akan ada motivation untuk kerja lah. Okay, kenapa I kena ambil darah patient cepat-cepat? Okay, kenapa I kena clerk juga semua patient ni walaupun patient ramai? Okay, you need to understand why. You need to understand the significance of the things you do, baru you ada motivation, baru you rasa macam, baru kita rasa okay, benda ni penting, that's why we need to do. Okay, so okay, dah nak 1 jam dah ni. Okay, I will go through the case discussion cepat sikit. So hopefully we can finish in 10 to 15 minutes. Okay, so let's go through a case discussion so that we understand kenapa penting untuk kita faham. Okay, apa yang kita buat. Okay, so this is a case discussion. This is clerking notes from Medical PHO books. Okay, buku ni dah tak dijual lagi sebab all the content kita orang dah jadikan handout untuk PHO online lah. So kalau you join PHO online tu, you dapat all the content free. Okay, boleh download. Okay, so so let's have a quick case discussion lah. So this is pediatric department. This is clerking sheet in general pediatrics. A 4 years old come with post fitting. Okay, so ini adalah you punya a clacking sheet. Okay, we will go through shortly. Okay. So we will always start with our chief complaint. 4 years old come with post fitting. So you need to have what are your differential diagnoses. Okay, what are your differential diagnoses in mind? Okay. So history of presenting illness is you describe the fitting. Okay. Okay, and then past medical history. Okay, this is a template kalau you kerja di hospital yang non computerized, bila tanya patient dia ada this set of questions that you need to ask. So it will be really helpful for you to know what you need to ask. Dan you tak tinggal important points. Okay, so you kena tanya past medical history. Okay, the birth history. Okay. So, what do you think? Kalau patient ni 4 years old and ada fitting, why is it significant to ask the past medical history, the birth history and the developmental history? Okay? Kenapa? Okay. So, you need to know whether this patient have a normal development or not. Okay. For a previously normal child having fit, this could be something acute. Febrile fit, electrolyte imbalance, okay. But if, okay good, Divya Darshini, but if this patient have some developmental delay, okay, the diagnosis could be different, okay. So that's why it's important for you to understand why you need to ask certain things. Okay, why you need, kenapa semua patient, okay, sebab ada some houseman come to me, dia tanya, kenapa when patient come, I have to ask the same set of questions. For all patients, I have to do macam a lot of repetitive tasks lah, okay. So, you need to understand why you need to do certain things, okay. So this is a typical family history or family tree. Usually in pediatric, you will need to draw this so that we can identify any diseases that runs in the family. Okay. You need to know about the social history because fitting could be due to intracranial bleed, due to non-accidental injury or case sterile. Okay, so you need to know about the social history as well. Okay. And your general examination, okay, so this is a previously normal child having fitting on top of fever, okay, otherwise patient is well during the illness, so your most probable diagnosis is febrile fit, okay. So when it is a febrile fit, you need to identify what caused the fever, okay. So from your physical examination, what's important in pediatric patient, usually a patient punya general condition, the hydration status, okay, because usually any pediatric patient when they are not well, they have reduced oral intake, so you need to give a supplemental IV drip for them, okay. So for this patient, it looks like the fever is caused by the tonsillopharyngitis, okay. And this is your usual final page of clacking where you need to write your provisional diagnosis. Okay, for example, for febrile fit, you need to identify whether it's a simple or complex febrile fit, and you also need to rule out more sinister diagnosis, for example, meningitis, surgical occupying lesion or intracranial bleed, okay, and your investigation, okay. So when you are new, you need to remember that any fitting patient or febrile fit patient, we need to take your the FPC and also the electrolytes, okay. But as you go in the posting, you need to understand why, okay. Kenapa kita ambil FPC? To look for infection. Kenapa ambil electrolytes? Because electrolyte imbalances can cause seizure as well, okay. So which electrolytes imbalances can cause a seizure, so you need to read up lah, okay. So this is the usual plan. Okay, so you can follow your venoms, ventilation, IV drip, okay, oral intake. Monitoring is your fit chart and vital sign monitoring. Medication is medication for the fever. That is your paracetamol. Okay, so you will give the suppository parental stat if patients still have spiking of fever, and you continue with the oral syrup paracetamol. Okay, and also you can start antibiotic in view of the acute tonsilopharyngitis. Okay, so this is an example of a very common case you need to clerk. So if you're working night shift, you will have usually 2 or 3 febrile fit because the parents are anxious. Okay, so despite clerking the same case over and over again, asking the same set of questions for the same diagnosis, you still need to have in mind your differential. Okay, the physical examination finding will be differ from one patient to another. Okay, so you still need to have that critical thinking process along the way. Okay, don't do everything as a routine. Bukan semua patient yang masuk fitting to equal to simple febrile fit. They have different differential as well. Okay, so that's why. Okay, then after you clerk, your job doesn't end there. After you clerk, so those investigation you need to fill in the form. Okay, if you are in traditional or non-computerized, this will be your pathology form. And also this is your prescription lah. Okay, but this is an example of prescription for another patient lah, of another adult patient. Okay, so Divya Darshini asks, Doctor, can HO start antibiotic or prescribe medication before MO come? Okay, so good questions. Any houseman can prescribe. Okay, in Malaysia we have different list of drug or classification of drug. We have list A. List A is only by specialists. List B can be prescribed by any doctors, and list C can be prescribed by any doctors or paramedics. Okay, so example of list C is your paracetamol, syrup Benadryl, and antihistamine. Okay, example of list B drug is your antibiotics. Example of your list A drug is all the fancy and more expensive drugs. Okay, so to answer Divya questions, you can prescribe any list B or list C drug if you are confident with the indication and you are confident there is no contraindication. Okay, so if it's something routine, mean if it is a first line medication, means for example for your department, the first line medication for community acquired pneumonia is IV augmentin. Yes, if you confirm the diagnosis, it means it's indicated and patient don't have any contraindication for augmentin, you can prescribe medication. Okay, so any list B and list C, provided you know the indication, you confirm the indication, you rule out any contraindication for that drug, then you can prescribe. But usually for taggers biasanya nurses pun tak akan execute the plan, ataupun they usually will wait for MO to come and double check. Okay, you can also double check your plan with your senior houseman. Okay, Fazrin tanya, RP and Buse, do we have to take different bottle or just one? In my hospital, you can send in one bottle because the same bottle RP and Buse will be done by biochemical lab. Okay, so dia pergi daripada satu lab yang sama. So you boleh hantar satu botol saja, satu botol sampel untuk RP and Buse. Tapi FBC tak boleh campur lah, because FBC go to hemato ward, RP go to biochemical, and also they need two different region. Okay, so Emily Tang, I think usually patient will be seen in ED by MO, so usually antibiotic is in the plan already. Okay, it depends on your hospital. biasanya hospital yang lebih besar or the tertiary hospital, the MO of respective department will see the patient in emergency department before the patient is sent to the ward. So houseman kan kita tengok patient dekat ward kan. So kalau MO dah tengok dekat ED, emergency department, usually dah ada plan of management. You just execute everything, okay? But if you are in more smaller district hospital, most of the time patient come straight away from emergency to your ward. Okay, so you are the first doctor from the department to see the patient. So your MO might not seen the patient yet. Okay, so it depends on your flow of admission. Okay, of your patient. Okay. So with that case discussion, so what we can do now? Okay, so basically you have answered previously, okay, so kena study, kena baca buku, okay. It's good to see that you have the initiative already, okay. Okay, brush up your clinical knowledge. There are a lot of online CME, okay. As well, okay, there's one good question from Muhammad. Where to get the list of which tube to go to which lab? Don't worry, you will have this table satu waktu hospital orientation. Kalau ada slot by pathology lab, dia orang akan bagi tahu, okay, investigation apa masuk dalam tube yang mana, pergi lab yang mana, borang apa nak isi. Kalau tak ada, usually dekat you punya ward punya whiteboard, dia akan ada lah. Kalau investigation apa, which tube and goes to which lab. Okay, so that is something that you tak perlu risau sekarang lah. There will be reference for that. Okay, so next is how to revising your clinical knowledge is important, but what's more important, like I have said before, is to practice applying the knowledge. Okay, so macam saya mention waktu Tafiz bagi suggestion about Venom's formula tadi, about how to think like a doctor. Okay, you need to start to think like a houseman. Okay, so you need to think what are the symptoms that the patient might have, how you diagnose the patient. Okay, so this is best done through case discussion or study group. Okay, sebab most of CME, if it's a short session of half or 1 hour, are usually theoretical CME, which is good but not really enough. Okay. A few more questions. Okay. Ashraf asked, what is the difference between renal profile and blood urea serum electrolyte? Okay, so usually renal profile includes only urea and creatinine without your electrolytes, while BUS blood urea serum electrolytes include your urea electrolytes and your urea creatinine and your important electrolytes such as natrium, potassium and apa lagi satu? Chloride. Okay, so RP is just your urea and creatinine, but BUS add on your electrolyte as well. So Darren Lim, what other HO part in HO task in OT tak sempat cover. Okay, basically you need to assist surgery, but there's a lot of things to do as well. You can learn in essential pre-HO, or kalau sempat saya cover in another CME. Okay, so Diana Nasiha asks, is it true if we took patient bloods more than what is needed, we will be penalized? Okay, I'm not sure about this, okay, but usually some departments are strict about this, because first, when you poke a patient banyak kali, okay, it will cause discomfort obviously, and pain, and also you make the next blood taking more difficult because you have used that vein. And especially for pediatric department, we are very strict about the attempt, berapa kali attempt lah. So houseman kena 2 kali je. Kalau you tak dapat, you need to ask your MO to take the blood. Okay. Kalau you ambil darah yang tidak diperlukan, it means not indicated. First is your attempt, it cause discomfort to your patients. Second, if you took more than what is indicated, you will cause kita akan membazir resource lah. You will use more syringe, you will use more tube. All the investigation center will take some resources to be nak run the investigation kan. So it will take extra resources lah. So akan membazir resource. So some department, yes, are becoming more strict to only do investigation that is needed. Okay, so along the way you can ask your seniors. Okay. What about night shift? Night shift, task night shift. Basically sama lah, you tengok the task night shift people is what we do dalam list tadi from 5 PM to 10 PM. After 10 PM, you don't have any more rounds, but you need to keep all your patients safe. And there will be ada patient yang unstable, everything kan. So you need to attend as well. Okay, Hazirah Takini Hafizan asks, for tagging, is there a time where we tag in OT or labor room or only either ward? Okay, Hazirah, very good questions. If you are in surgical base department or in ONG department, you have to divide yourself. Okay, so usually waktu siang tu, okay, I'll give an example of my ONG posting lah. Okay, my ONG posting, 2 weeks of tagging, pukul 8 to 5, okay, daripada 7 pagi sampai 5 petang, semua taggers perlu berada di PAC atau Patient Assessment Center, Patient Admission or Assessment Center. Means kita akan clock case je, okay, daripada pukul 8 pagi sampai 5 petang. After 5 petang, dalam masa 2 minggu tu, you have to divide yourself, okay. 3 days kena tagging dekat OT to assess Caesar, and the rest of the day kena tagging dekat labor room. Okay, that was for my department lah. So you pilih sendirilah hari apa yang you nak tagging dekat OT, hari apa you nak tagging dekat labor room. Okay, so usually the surgical base department sama juga, dia orang ada requirement berapa hari you kena tagging dekat OT, but you have to arrange yourself. You kena pilih sendiri hari yang you nak pergi tu. Okay, macam mana nak pilih hari apa pergi tagging dekat OT, yang tu saya cerita dalam Essential Pre-HO. Okay. Okay, I think I have covered all the important questions. There's a lot of beneficial and informative comment from your senior houseman, Dr. Iziani, Dr. Aisyah. Okay, nanti scroll through the comments lah. Okay. So what you can do now, please stay for 5 minutes for this announcement. Okay, inshallah Medicorp will start our departmental courses, means our pediatric crash course, ONG, orthopedic, okay, and it will be online. Okay, previously it is quite tough for us to arrange the online departmental courses because all of your MO and specialists are really busy during this COVID time, so we don't manage to record them. So what we do, if we will have a live teaching in a private FB group, okay. So for example, for pediatric online course, we will have 3 hours session every Saturday, starting from this Saturday. Okay, so we will have 5 weeks. Okay, so every Saturday from 9 AM to 12 noon, Okay, so 3 hours per week every Saturday morning. Okay, you will have your specialist and your MO from pediatric department to share. We will cover half of the compulsory topics for houseman in pediatric, and all of our teaching are case-based discussion. Okay, it's a little bit theory, but we will focus the large time for apa ni, for discussion. Okay, so kita akan discuss. Kalau patient case AGE ni, you nak tanya soalan apa, you nak investigate apa, you nak order investigation apa, you nak buat review macam mana. Okay, so we will learn and practice along the way. And apart from these 5 compulsory session, you will have extra tuition by me in the private FB group as well. Okay. Okay, so we will open up the registration tomorrow night. Okay, because my team are still finalizing the fee and some technicalities about it. Okay, so stay tuned at my Telegram channel for more announcement about pediatric online course. It will be 5 consecutive weeks. Okay. Kalau you tak sempat tengok waktu the live session, we will keep the session, the recording or the video in the Facebook group so that you can watch them later. Okay, and after pediatric online course, inshallah we will start our obstetric and pediatric and orthopedic online course as well. Okay. So, Muhammad tanya where is the private FB group. Nanti kita orang bagi tahu lepas yang dah register, siapa yang register nanti. Okay. So there will be some fee after you register. We will you all kena request nanti team saya akan bagi detail lepas yang register. You kena request untuk join that FB group. Okay. Will there be Q&A session during the CME? Okay, kalau you tengok the live session, kalau untuk PID ni live session dia every Saturday 9 AM to 12 noon, you can ask question directly to the speaker. Okay, and you have to answer some question as well lah. Okay, so it'll be we hope to make it interactive. Okay. Okay, so stay tuned for more details tomorrow. Okay, we have few alumni. Fikri Embong, I recommend to attend all CME done by Medicorp. Will help you a lot during housemanship. Thank you, Fikri. Seorang lagi, Dr. Iziani. Saya alumni Tegar Medicorp now in NICU tagging. Medicorp departmental courses are very helpful. Okay, thank you for your review. Okay, thank you everyone. It has been 1 hour plus. Thank you for staying up to this point. Okay, this session will be available on Facebook and later I will upload it in our Medicorp YouTube channel as well, and I will share you the slide of tonight's session in my Telegram channel. So thank you everyone. Thank you for your time. Okay, see you in our next session. Okay, and also in our departmental courses as well. Okay, all the best. Assalamualaikum. Good night. Stay tuned dekat komen, nanti saya pilih 3 doktor yang bertuah. Okay.